Hi everyone. In this video, I'm going to talk about the rise of obstetrics in Singapore in the period of about 1910 to 1970. So in this video, I will talk about the medical school, which was started in 1905 by the colonial administration, and then how this demonstrated a transfer of knowledge from the metropole to the colony, where European midwives and medical officers were sent as instructors to the local population. And finally, how medical training is a form of socialization into obstetric thinking, which means that society begins to accept certain assumptions and beliefs which are based in obstetrics, but then are taken as common sense. So this is from correspondence between the Straits Settlements and England. And in this case, it was about the establishment of a medical school in Singapore. Here you can see 17th March 1905, where the petition from certain inhabitants of Singapore to the Governor Sir John Anderson most respectfully show that they would like to have the importance of a general comprehension of proper sanitary conditions and habits is of paramount importance to any country, and your petitioners feel that no measure can so successfully diffuse this understanding as the provision of a proper supply of trained medical men who are in racial sympathy with those whom they attend. Your petitioners therefore humbly pray that your excellency will give this matter your earnest consideration and take steps to get a proper scheme framed for the establishment of a medical school in Singapore. And they also talked about scholarships. There should be of sufficient amount to attract the best boys from the schools. So yes, in the beginning, they only gave scholarships to boys to attend a medical school. And there were 5 scholarships every year. So this was that medical school. It was named the King Edward VII College of Medicine. Okay, so just sidetrack, there is a book by Farida Abdul Rashid who wrote about the early Malay doctors in about the same time period, 1900 to 1957. And she has in her appendix a list of Malay doctors from the medical school from 1910 to 1940 and then also 1950 to 70. So if you're interested, you can see if maybe these were one of your ancestors. Of course, these are all Malay doctors. That means today they would also be from what's considered Malaysia, not just Singapore. Okay, so this medical school was a 5-year course, and it trained doctors in medicine, surgery, and midwifery. But then in 1919, the General Council of Medical Education and Registration of the UK sent a warning to the government that if the standards of teaching and examination were not fully maintained, the council would have to reconsider the recognition of this license. So this was because, especially in midwifery, the medical students did very poorly. Because of this warning, they decided to change a few things, one of which was to convert Kanakaba Hospital into a maternity hospital. Then they also changed the curriculum and instituted a professor of midwifery. And then in this new maternity hospital, the medical students would be able to practice on the pauper women who were allowed to give birth for free in this maternity hospital. So after they got this warning, the director of medical and sanitary services said that, it was good for us. We have decided to change a lot of things. And we hope that in the course of time, this school will become one of the most important, if not the most important medical institution in the Far East. And it's kind of like foreshadows how this school was being considered in 1980. Here we have a press release where President Shears said that we should remind ourselves that graduate numbers alone do not a great medical school make. And the worth of our basic medical degree is too well known to need reiteration. So I guess what the director said in 1919 came true. Now we have a medical school, and how were the doctors being trained in order to become this new medical men for a new age? Well, one of the most important things was the prominence of severe events. This creates a form of socialization for the doctors, where you kind of prove that birth is dangerous and that obstetric intervention is needed in order to save mother and baby. So in this publication of the Obstetrics and Gynecological Society, there are a few color pages at the back of the book where photographs of these instruments are preserved for posterity. Here we see a cranioclast, which was a destructive instrument used in the days prior to the prevalence of cesarean section. It was considered lower risk to the mother when removing a dead fetus compared to cesarean section. So this was in a time where antiseptic procedures was not perfected yet, and so there was a high rate of infection or death for the mother if a cesarean section was done. So in cases where the baby was already dead, or there was a choice to save either mother or baby, the fetus would be cut up by one of the instruments, and then this was then the fetus would be removed in pieces. So this was used to crush the fetal skull, I think, cranioclast. Other destructive instruments include from the top a decapitating hook, which does exactly what it's described to be. A smelly perforator, so to perforate the skull or the bodies and remove the organs. Usually what they would do is crush the skull and then the baby will be small enough to remove, or they would try to decapitate and crush the skull and remove the pieces. The third one is a loaded perforator. So with the spring, there's more power to cephalotribe. The last one is to crush the bones of the fetal skull. And these are forceps, which became common later when a lot of pain relief drugs were being used in the hospitals. So you can see, like, they write there, some Wrigley and Neville Barnes forceps are still in use. Killen's forceps and Piper forceps are no longer used. So you can see technology has its ebbs and flows. Things which are considered at the time modern and new and a vital technology can be, after some years, phased out. So it's good to take everything with a grain of salt. Not everything that comes out right now is always a progression from bad to good. More forceps. Here it says, in the past, mastery of the Killen's forceps was considered a hallmark of a good obstetrician, but today it is rarely used. So I have decided to split up the video into two parts. So this is the end of part one. See you in part two.